Hello, everyone. Thank you for joining us today for our webinar on Behavior Economics 101. My name is Michael Rausch, and I am the Manager of Financial Empowerment and Innovation at the National Disability Institute. Today, I am joined by Win Lum, Philanthropy Manager at Bank of America, Nicole Truog, Associate Director, the Center for Financial Security at the University of Wisconsin-Madison, and Anya Samak, who is the Assistant Professor at the University of Wisconsin-Madison. Before we get started with today's webinar, we do have some housekeeping tips that we need to go over, and my colleague Nakia Matthews is going to cover that information. Nakia?
Good afternoon, everyone. The audio for today's webinar is being broadcast through your computer. Please make sure that your speakers are turned up or your headphones are plugged in. You can control the audio broadcast via the audio broadcast panel, which you see here below. If you accidentally close the panel, you can reopen it from the top menu item by going to Communicate, Join Audio Broadcast. And you can also use this to control the sound if the sound becomes distorted. If you do not have sound capabilities on your computer or you prefer to listen by phone, you can dial the number you see here. I will also put the information into the chat box, and you do not need to enter an attendee ID. Real-time captioning is provided during this webinar. The captions can be found in the Media Viewer panel, which appears in the lower right-hand corner of the webinar platform. If you want to make the Media Viewer panel larger, you can minimize some of the other panels like chat, Q&A, or participants. And conversely, if you do not want to see the Media Viewer panel, you can minimize it. There will be a question and answer session at the end of the webinar. Please use the chat box or the Q&A box to send any questions you may have to us during the course of the webinar, and we will direct the questions accordingly. If you are listening by phone and you're not logged into the webinar platform, you may also submit questions by emailing them directly to me, Nakia Matthews, at nmatthews@ndi-inc.org. Please note that this webinar is being recorded and that the materials will be placed on the NDI website. If you experience any technical difficulties during the webinar, please use the chat box to send me a message, Nakia Matthews, or you may email me at nmatthews@ndi-inc.org.
Great. Thank you, Nakia. Today's webinar is our second in a three-part series that we are doing with support from Bank of America. Our first webinar was introducing us to financial capability and key concepts and strategies surrounding financial capability. Today's webinar is to introduce us to behavior economics. What is it, and what is the impact of behavior economics? Our guest today will help us understand this topic. We are thankful for our friends from the University of Wisconsin, the Center for Financial Security, for partnering with us today on this webinar. Please note that today's webinar is not disability specific, as we are exploring this topic together. And then together we will ponder how behavior economics applies to the work that we are doing together to advance the economic self-sufficiency for persons with disabilities. Our objectives for today's webinar are to define behavior economics, understand key components, and look at strategies to use as we work to create positive financial habits for clients we serve. I would like to thank our sponsor of today's webinar, Bank of America, for their support of expanding the financial capability of persons with disabilities. I would also like to thank Bank of America for choosing the National Disability Institute to be one of the nonprofit organizations highlighted on Bank of America's Times Square billboard this weekend and the weekend of June 1st. If you are in the New York City area and can make it down to Times Square, please do and take a picture in front of the billboard when our logo comes up and send it to us. We'd love to highlight our partners with the Bank of America billboard and NDI logo displayed, and we're very honored for this opportunity, and we thank Bank of America for highlighting the National Disability Institute. For those of you that are new to the National Disability Institute, before we turn it over to our presenters, I would like to share with you a little bit of information. The National Disability Institute is a national nonprofit organization dedicated to building a better economic future for Americans with disabilities. We are the first national organization committed exclusively to championing economic empowerment, asset development, and financial stability for all persons across the full spectrum of disabilities. National Disability Institute affects change through public education, training, technical assistance, and policy development to help the 1 in 3 Americans with disabilities living in poverty take steps towards brighter financial futures. To learn more about the National Disability Institute, go to www.realeconomicimpact.org. At this time, I would like to turn it over to our friends at Bank of America, and we have Win Lum, who is a philanthropy manager at Bank of America, who's going to share some information with us. Win, have you been able to join us? All right, so I think Win will be joining us in just a minute. Until he does join us, Nicole, can I turn it over to you?
Yes, hi. Can you hear me okay?
Yes, perfect.
Okay.
Thanks, Nicole.
Great, yeah, no problem. Well, I'm delighted to participate today, and I just wanted to take a moment to say a few words about the Center for Financial Security at UW-Madison. We are an applied research center, and our research really focuses on working to build financial capability for families and individuals over the life course. We do this through research that looks at the measurement of financial capability, targeting interventions to populations at risk, and also testing strategies and products and services. And so I couldn't leave you today without a little plug for the center and have provided some resources here. I hope you'll take a look at our website where we have a lot of our research published and also policy briefs that are 2 to 3 page snapshots of our research. And all of our research, we couldn't do it without our affiliates, and Anya, who you'll hear from, is one of 50-plus affiliates who are researchers across the country and across campus working to look at financial capability. And if you're interested in learning more about financial security over the life course, we do have an online conference coming up. That's the Pathways 2013 link. So thank you to Michael and his team, and I look forward to hearing more from Anya.
Great. Thank you, Nicole, and thank you for joining us today and for connecting us with Anya. I think we might have Win back on the line, so just before we turn it over to our main presenter, Win Lum will be joining us momentarily. Nakia, I sent you the number. One piece that I'd like to share with you before Win joins us is that we have a partnership with Bank of America's Disability Advocacy Network, and we are partnering with members of the Bank of America team to increase awareness on financial wellness for persons with disabilities through 2 opportunities. We have the financial education training as well as disability awareness training for VITA volunteers, tax and asset building coalitions, debt management partners, IDA, and financial education providers. If you are interested in being connected with a representative from Bank of America through the Disability Advocacy Network, please send me an email, Michael Roush, at MROUSH ndi-inc.org, and we will be able to connect you to these volunteer opportunities within your area. And so now what I'd like to do is I think we have Win Lum on the line. So Win, I'll turn it over to you.
Michael, thank you very much, and thank you for talking about the Disability Advocacy Network at Bank of America. And you had mentioned earlier the mission for the National Disability Institute, and your mission is the reason why we are pleased to partner with you and your organization to help consumers be better able at managing their finances. And you had mentioned the Times Square recognition, and we are recognizing a handful of our national partners and the wonderful work that they do. So thank you for doing the work that you are doing. And this is a great time to be part of this conversation and this learning session that we're having, because I'm in between frazzles. And so this is a great day that you picked for this conversation. And when I mean I'm in between frazzles, we just finished with Mother's Day. And I was just stressed out on what to get and the gifts that I had to buy, and now we're going from Mother's Day to Father's Day to graduations to proms and everything else that we have to do, not to mention the daily necessities that we all have. And so how do you pay for all of that? What do you decide to get? What am I going to get? What's going to make Mom happy? What's going to make Dad happy? What's going to make the graduate happy? And then, can I even afford to do it? Well, I don't have to worry about affordability, do I? Because the marketers are telling me out there that I can pay with Easy Pay, I can do layaway, I can do installments, I can pay with other people's money. And so all of this is stressing me out, and because we all know that impulsive buying can lead to some bad habits. And we need to be more thoughtful, we need to be more deliberate, we need to be able to help ourselves manage our finances. So that's one of the reasons I'm interested in the work that the National Disability Institute is doing, but also the work that's being done by the University of Wisconsin Center for Financial Security. They're some of the leading pioneers and experts and smart people doing this work under the leadership of Dr. Michael Collins and Nicole Truog, who we're going to hear from today, Dr. Samak, and all of the work that they're doing to help us achieve financial security. So we at Bank of America believe that consumers should be more thoughtful and should be able to help themselves, because better consumers make better customers for us, but they also help relieve the stress so that we're not all frazzled with understanding how to manage our finances. So, Michael, I'm interested in learning from the panelists today and what they are doing. Thank you for letting us be a part of this.
Great. Thank you, Wen. We appreciate you being on the call today. So now is the main part of our webinar presentation today, and we're really excited to bring this topic to you all. It's a topic that we've been exploring and looking at, and as we've traveled across the country, partners from both the asset building community, financial services, as well as the disability community have said to our team, what is behavior economics? What does it include? Please bring us some information on it. And so when we reached out to the University of Wisconsin, they connected us with Dr. Samak, and who is going to share some great information with us today. And she's been studying behavior economics, and we're delighted to have Dr. Samak join us today. So with that, Anya, I'm going to turn it over to you.
Great. So hopefully everyone can hear me.
Sounds great.
Yes? Good.
Yep. Good.
So my name is Anya Samek, and I've been a professor at the University of Wisconsin-Madison and the Center for Financial Security the past year. Before that, I was doing behavioral economics research at the University of Chicago, and I received my PhD in experimental and behavioral economics from Purdue University. So I've been working on behavioral econ for quite a while, and I'm mostly working on general behavioral principles that can be shared across many domains. So not just thinking about why people choose to save versus spend, or how people choose to allocate their money and what behavioral biases exist in that decision, but also other but very related topics such as why do people choose to exercise or not, why do they choose to eat healthy or not, how do people decide about philanthropic giving, and so on. And so today I'm going to be more general, and you'll learn a little bit about the different main principles in behavioral economics and how they can be applied to a few contexts. So when I talk today, we're going to break the presentation up into 3 components. So I'm first going to tell you what behavioral economics is. So as Michael said, that's Behavioral Econ 101. Then I'm going to tell you a little bit about how economists use experiments to study behavior. And finally, I'll give you some lessons on how insights from behavioral economics can be applied in real settings and give you some examples of studies that have done this. So before we get started, I'm just going to tell you about economics. So when a lot of people think about economics, or if I meet someone at a party and tell them I'm an economist, people usually assume that what I'm interested in is studying money. So how do people decide to spend their money? What does the GDP look like? And these macroeconomic questions. But really, as economists, we think about any decision being an economic one, because microeconomics is really the study of how individuals or firms make decisions to allocate limited resources. The limited resource could be money, but it could also be time. So you could think about choosing whether to buy a TV or invest that money in a retirement account as an economic decision. But you could also think about choosing whether to spend time watching TV or choosing to spend that time exercising as an economic decision because you're allocating limited resources. And as economists, we have 2 main components of a decision. So the first component is the constraint. That tells us what the individual can do. So it gives us the amount of money they have to spend. It gives us the hours in a day that are available to allocate across activities. The second component is preferences. That tells us what the individual wants to do. And in general, we assume that the individual's objective is to maximize his or her satisfaction, whether they receive satisfaction from activities or they receive satisfaction from consumption goods. So that's in a nutshell how microeconomists think about decision making. So let's start. What is behavioral economics with one anecdote? So suppose we have George, who's choosing whether to invest in a 401k plan at work. This slide tells you what we would typically believe George will do. As economists, this is what we believe George will do, and as policymakers, we might also believe this is what he will do. So we give George some information about the 401k. We give him that information under the assumption that he's going to carefully consider all of the information that's given to him, and then he's going to use all this information to maximize his satisfaction over his lifetime. So he's going to know exactly what he's getting into, and he's going to think about how he feels today, how much money he needs for consumption today, and how much money he will need for consumption at retirement. We're also going to assume that George is doing this in a bubble. So he's ignoring what his friends are doing, he's ignoring what others are doing, he's focusing only on the information that's given to him. Now, here's the behavioral econ of what really happens. What really happens is that George doesn't have time or processing capability to understand fully the information that we give him. So he may glance at some of the information that is given to him, but he's not going to have the full information. So even if the full information is in front of him, he's not going to be fully processing that information. Second, he is going to try to maximize his satisfaction over his lifetime, but then he might put it off till later. Or he might not very easily anticipate his future satisfaction or understand what his future self will need at retirement. He's also not in a bubble when he's making this decision. So he does all this after checking what his friends are doing, what his colleagues are doing, what's on TV, and everything else around him is going to have an influence on his decision. Moreover, because he's only glanced at his information, the information about what his friends are doing might even be more of an influencing factor than if he had fully processed that information. So this illustrates what I like to think of as the three principles of boundedness, that people are bounded in their ability to make these sorts of decisions. And that's really what behavioral economics is all about. It's this idea that there are behavioral biases that prevent people from doing what economists believe is their objective, which is to maximize their overall lifetime satisfaction. So the first one is that George carefully considers all information. Likely that doesn't really happen. What likely happens is that George falls prey to what's called bounded rationality. Processing information is costly from a time perspective, from an effort perspective, and there can be common biases to how information is perceived. So probability information is very difficult to process. Information that is far in the future is difficult to comprehend and apply to your own situation now. The second one is George maximizing satisfaction over his lifetime. What really happens is that people have bounded willpower, and that's another way of saying that they discount the future. So they put off doing things they don't like to do, but they believe that they'll get to it later. And finally, George ignoring what his friends are doing. In fact, we know that people care about others. They make decisions with the impact of their behavior on others in mind, and they also use cues from the environment, especially cues from advisors, to make those decisions. And these three principles are what we can also think of as the psychological underpinnings of behavioral economics. So behavioral economists take a lot of insights from the psychology field to try to understand what it is about the brain that causes these biases. For bounded rationality, we know that the brain is limited in its capacity to process information. So we're not all calculators that can immediately process spreadsheets of information. It takes a lot of time to process this information. When information is difficult and complex to process, people often use rules of thumb. So one rule of thumb could be, I'm just going to look at the very first asset on that list of assets that I could contribute to, and that's the one I'm going to choose. These kinds of rules of thumb can lead to a few problems. So it can lead to overload of information. If there's too much information, I may not make a choice at all. It may lead me to incorrectly understand the probability of positive and negative outcomes, especially for the financial assets. The next psychological underpinning is bounded willpower. So bounded willpower is another way of saying time preferences. People have different preferences for money today versus money in the future. People often lack self-control. So as we were talking about impulsive buying, we may buy something today if the consequences of that choice do not arrive until later in the future, for example, in a few months when the credit card bill is due. Bounded willpower makes it so we may not be doing things that are good for us, even though we know that those things are good for us. Finally, bounded selfishness is the last psychological underpinning that I want to highlight. In general, people like to help others. They use cues from others to understand the costs and benefits of different decisions, and we fall prey to marketing as well. People also care about people in their own in-group succeeding. So we may do things or spend money on things that help people in our in-group. So behavioral economics is economics but takes it a step further. We use concepts from psychology to investigate how social, cognitive, and emotional factors motivate decision-making. Whereas before, when we were just microeconomists, we made simple assumptions like George prefers $100 to $50. $100 is most likely to give him a higher satisfaction than $50. But that might not always be true. So for example, people will prefer sometimes $50 to $100 if they can get the 50 now, but they have to wait a year to get the 100. So people are impatient. The other one that could happen is you could prefer $50 to $100 if getting 100 requires filling out a form. that's why mail-in rebates tend to be so popular, is that people believe that they're going to fill out the form, but they never get around to it. Filling out the form is costly. It takes time, and it takes processing power to remember that the form needs to be filled out. You prefer 50 to 100 unless getting 50 means that your financial advisor is less well off. So not only do we care about how people in our in-group are doing, our family and our friends, we might also feel bad about going against a financial advisor's advice if that means that the advisor will be less well off. So the next question is, why do we study behavior? And we're interested in studying behavior for a few reasons. So first, we're interested in describing what people actually do and why they do it. Second, and more importantly, we want to recommend what individuals ought to do and what society ought to do. So what kinds of interventions or policies should be in place to help individuals make better financial choices or make better health-related choices, and so on. In order to recommend interventions, we need something very important, which is cause and effect. So in the example here, we believe that the apple is the cause which is causing the surgeon guy to fall backwards. But we need to be sure that it really is the apple that's having this effect before we can recommend that apples should not be allowed at the hospital. Perhaps this guy just had a cold and was sneezing and the apple happened to hit him at the same time. We need to be very careful to disentangle the effects of these two things, because otherwise removing that apple would not have the effect that we expected. So studying cause and effect relationships can help us clearly point out which interventions are going to cause certain behaviors to occur or not occur. And that brings us to my next point, which is, how do economists study behavior? And when we study behavior, what we care about most is this cause and effect question. So I'm going to give an example of a case study on financial education, and we'll talk a little bit about what it means to try to disentangle the causes and the effects. So suppose that we are studying the ability of associates who work at a firm to make better choices about how they manage their finances. So to that extent, we advertise a new educational program. Let's call it Grow Your Wealth, and we invite 5,000 qualified associates at the firm to join the program. 2,000 of them are interested in learning to save money, and they decide to participate. We invite all 2,000 to join, and they all do very well in the program. At the end of the study, we make the following comparison. We compare the group who has participated, the 2,000, with the group who hasn't participated, the remaining 3,000 who we invited but who did not join. We find that the 2,000 have clearly done better. So they've saved more money, they've decreased their loans, and so on. So the question is the program a success? By most measures, it seems like it is. But what really happened? So one thing that happened is we had what economists call selection bias. The selection bias caused our results to be overstated. So we have the guy on the left who joined the program because he wanted to start saving money. He may have chosen to start saving money anyway, but the program helped him. So he's representing those 2,000 who chose to join the program. We have the guy on the right who didn't join the program because he didn't care about saving money and he'd rather buy a flat panel LCD TV. So this guy is very different from the first guy. That's selection bias. The types of people who joined the program were very different from the types of people who didn't. And now we can't find a cause and effect relationship. We don't know if it was the program or the types of people who joined it who caused the effect, because we compared a bunch of people who are like the guy who's watering his plant to the guy who's holding up the no sign. We know for sure that the no guy is not going to be saving money, but we're not clear whether the guy watering the plant would have saved money anyway or not. That causes us to overstate our effect because the guy who joined the program also had the motivation, the intrinsic motivation to save from the beginning. The problem with this is then if we start recommending the program to others, we often recommend it by saying that any person who joins the program will be able to save. But that's not entirely accurate because we have no data on the guy who didn't want to join the program and whether him joining the program would get him to save or not. So one way that economists try to get the cause and effect relationship is to do what's called a randomized field experiment, or an RCT, a randomized control trial, is what it's called in medicine. So the way we would go about this is slightly different. So in the same scenario, suppose we have 2,000 people who chose to participate in the program, and these 2,000 people were located in 5 different cities. After the associates express their interest to participate, we select a random subset, so suppose we select cities A and B, and offer the Grow Your Wealth as a pilot just in those 2 programs. We then compare all those who wanted to participate in cities A and B with those who wanted to participate but did not get the opportunity in C, D, and E. What we've done there is remove the selection bias. So we know that it was the program and not the people that caused the effect. Now I see we got a question, which is that we don't know if anyone's income is sufficient to allow them to save anything, which is a very good question. And I'm using this just as a hypothetical example of a program we could use. You could imagine that the 2,000 who chose to participate, if we compare the A and B guys to the C, D, and E guys, we should have the same proportion of people with the different incomes in both groups. So we break those people into 2 groups, and we have what's called a control group and a treatment group. We control who gets offered the intervention. The control group is the group for comparisons. They wanted to participate but were not able to. The treatment group is the group of interest. They wanted to participate and were able to. We expect that because we randomly put people into groups, the same proportion of people with low income are both in treatment and control, and the same proportion of people with high income are in treatment and control. So in that way, we could actually get people's income at baseline, and we could compare across to look at how the different levels of income are affected by the intervention. So that was a good question. Now the next question, of course, is what about the non-participants? So we got these 2,000 to participate, 3,000 didn't participate. Is there anything that we can do to try to figure out whether we can bring programs to these non-participants? We can't force people to participate in a program, but we could use different behavioral interventions to try to get them to join the program. One such example is going to be incentives, and I'll talk about that in a bit. So, how do we get more participants in the study? We anticipate that the guy who did not want to join the study may not want to join it for a few behavioral reasons. So one of those is going to be that the consequences of not saving money are far in the future. He's not thinking about that right now. He would rather make a decision to have a benefit now, such as buying a TV or any other consumption good, and he wants to save later. What we know from bounded willpower is that he may actually believe that he will save later. So he believes that he is maximizing his satisfaction over his lifetime, but he cares more about the present than the future. One way that we could incentivize this guy to participate is to bring an incentive now to motivate behavior. Very good examples of this would be if every time he put money into his savings account, he received some kind of coupon or voucher or recognition on the company website showing that he's a good participant in the program. The other way to do it is to include a way for this guy to commit to joining the program later. So perhaps he could commit to join the program in 6 months from now, which he's likely to do because he does believe that he will save money later, he just doesn't have the willpower to save money today. Finally, we could use social feedback, so we could let him know about the social norm and about how many other people have joined the program and their success. So next I'm going to talk about how insights from behavioral economics can be applied, and this is where I'm going to bring up some real research examples. So this guy on the left is pressing the help button, and the reason is that we do think that people want to make choices that are optimal for them, but the problem and challenge is that they must overcome many behavioral biases. The ones we've discussed today are bounded rationality, bounded willpower, and bounded selfishness. So these are problems that people have that make it difficult, that are barriers for them to actually making the decisions that are going to be optimal for them. So I'm going to talk about 5 different lessons of behavioral interventions that can help to change behavior for the better. And the first one I'll talk about is the power of defaults. Then I'll talk about the cost of information. Then I'll talk about incentives for today. I'll talk about demanding a commitment, and I'll talk about some social strategies. And I'm not using just financial examples here because what we believe is that these behavioral principles can be shared across many domains, including financial decision-making, health-related decision-making, choosing to donate to a philanthropic fund, and so on. We'll start with the first one, which is about the power of defaults. In any decisions that you could possibly make, your inaction in that decision triggers some default result. So if you're at a company and you don't sign up for a health insurance plan by the deadline you're given, the default is no health insurance for the year. If you are at a company that has an opt-in 401k plan, the default for not opting into that plan is no 401k plan. If you do not sign up to be an organ donor, the default is typically you're not an organ donor. What we know from behavioral economics, though, is that if individuals put off difficult decisions to the future, the default will be the most likely outcome. So they procrastinate making the decision until finally the deadline has passed and they are nudged into the default state. Now suppose that we change the default. So we change no other policy except to say, now for the 401k, the default is going to be automatic enrollment. If you don't touch the paperwork and you do nothing, you are automatically in the 401k. If changing the default changes behavior, we call this a nudge. So we're not requiring people to join a 401k, we're simply changing the way that you join. Now, rather than having to join by doing paperwork, you have to choose not to join by doing the same paperwork. So the evidence that I have for Lesson 1 comes from a paper by David Leibson and his co-authors from 2004. They conducted a field experiment with an employer in which they changed over time the way that the 401k enrollment worked. So at first, the employer had an opt-in policy in which the worker must elect to participate in the 401k and then choose an amount to contribute. And then later, the employer had an opt-out policy with some default rate of 1% or 2% of the salary. In the opt-out case, the worker was defaulted into accepting a 401k participation and the rate, or had to act to opt out. Now, what they found is that this change in defaults significantly increased enrollments. In fact, when offered the default rate, many people were defaulted into that rate. So if you look just at the small graph on the left, you see here the fraction of participants, of employees who are in the 401k plan. The orange line shows the people hired during auto-enrollment. The amount is 80% of people who are enrolled in the 401k versus just 20% of people who were hired before auto-enrollment. Even after 48 months of tenure at the company, we see that the green lines below the orange line showing that being hired at auto enrollment does not cause people to opt out over time either. On the right, you can see here too the distribution of contribution rates, where the orange bars represent being hired during auto enrollment with a default rate of 2%. Most people stayed at the default rate of 2% regardless of their income. So we might expect people with a higher income to choose higher contribution rates and people with lower income to choose lower contribution rates. That did not really happen in this particular study. So the lesson here is that default rates are a particularly strong way to get people to change their behavior, and people don't even know that their behavior is being changed. But they must be used carefully because even individuals with a very low income who may not need to save in a 401k at all and should instead optimally be paying off their credit card debt are also being auto-enrolled in the 401k. So this policy, which seemed benign, actually caused a big behavior change. The next lesson is that information has a cost. So we always think about providing the consumer with as much information as possible in order to make sure that his decision is more informed. However, what we know from bounded rationality is that processing information is difficult and individuals often rely on rules of thumb. One thing we can do here is actually simplify information. So some of my work in the financial literacy domain is on using graphical representations, which can be more effective than text-based information to get people to understand financial concepts. More information creates overload and is not always better. If you have too many, for example, health plan options, you could cause worse outcomes by having people do more rules of thumb processing and less processing of full information. The type of work that I do is actually called visual analytics. So I use interactive visual tools that people can interact with to try to see things like financial portfolio selection and risk diversification visually rather than just textually, to try to see how credit card debt will pile up in a visual form rather than just knowing the APR, for example. We find in lab experiments that visual analytics can improve confidence, reduce decision time, and actually result in higher quality choices when information sets are complex. Lesson 3 is now incentives. So we know that bounded willpower makes it difficult to see the benefits of an action that is good for you. So suppose I know that exercising and eating well will improve my health in the long run, but I care less about the long run, I care more about the short run. If I have an incentive today to do something that's good for me in the future, that actually changes my decision problem. It creates an immediate benefit for my action, and now I'm considering the cost and benefit of the action with a benefit that I have in the present, whether it's a couple dollars every time I go to the gym, whether it's recognition from a friend that I did well. Incentives in the present are very important. The example I have here is a fun study that myself and my colleague John List ran in the lunchroom. In the school lunchroom, we actually see that over 40% of the content is thrown away by kids, which is a high rate of waste. We know that kids are at the highest BMI ever, and nutrition education has had limited effectiveness and is costly. So what we did in this study is we looked at the effect of providing small gifts to children if they choose a healthy food. We gave them the choice of a cookie or a fruit, and we told them they could only choose one. And we randomly put different school lunchrooms into different treatments. So we had a control group in which they just made a choice. We had a treatment group where they received a small toy if they chose the fruit, and the small toys were on the line of 10 cents each. And we had a treatment group where they received some education and also made a choice. The education was about a 5-minute message about the food pyramid. And this is the results we have. So we have period 1, which is before we did the intervention, and period 2, which is after. We can see that in period 1, about 20% of kids were choosing the fruit and 80% were choosing cookies, where cookies are the less healthy but higher benefit in the present choice. Now we can see what happens when we introduce education. It actually had no significant effect and almost a negative effect on the proportion of kids that are choosing the fruit. Finally, what we find is a very powerful effect of incentives. The fruit choice increased to 80% with only 20% choosing cookies when we introduced just a small toy. And these are 3 different incentive treatments that we ran. This type of radical effective incentives has also been documented in other work, including things like getting children to study for their exams, getting adults to attend the gym regularly, and so on, and is now being tested for different types of financial interventions as well. Finally, we have commitment devices. So individuals want to do better, but the bounded willpower prevents them from doing better in the present. So a commitment device is a way to assure that you follow through with the plan. A good example of this is CDs or restrictions on withdrawals in the financial services. Another good example is gym memberships. And finally, if you see people putting their credit cards in the freezer, that's a commitment not to take that credit card out even when you have bounded willpower to do it. So there's a study by Stefano Della Vigna and his colleague Malmendier in the last 10 years or so where they looked at analyzing data from gym memberships. The idea is that if people are maximizing their satisfaction, they should spend only as much money as they need in order to go to the gym. What these researchers actually find is that people pay more if they get a gym membership than if they pay per visit. And this is evidence for the fact that people value commitment devices. If the average cost per visit is $19 and the drop-in rate is $10, the people paying $19 are the ones who have the annual monthly membership. People are willing to pay up to $600 in this study for having this commitment device to make them go to the gym. Finally, social strategies are very effective. We can use social information and social cues to help people comply with desirable behaviors. So, for example, financial coaching has been very effective primarily because you're held accountable to another person and less so because of the financial information that they may provide you. If you learn you're standing in a social group, so if you learn that you are being less environmentally friendly than others in your neighborhood, you may be more likely to purchase environmentally friendly light bulbs. That's a study that one of my colleagues has done. Learning about what the social norms are helps people to conform to those norms, especially if those norms are things like weight loss and quitting programs, quitting smoking, and receiving a signal based on what a role model is doing. And finally, tying incentives, the now incentives that I talked about, to group performance seems to have a big effect because if I'm dragging down the group, I feel more like I need to be proactive in making sure that the group succeeds. Some evidence for this social strategies has been found in giving to charity, so seed grants are really effective at getting others to donate. Social information is very effective at getting people to donate to charity. Financial coaching, which I already said. Weight loss programs tend to be effective also because of the accountability component, and so on. And actually, that completes the discussion, and we can open it up for questions.
This was really thank you for the information that you shared with us today. This is really valuable information. We do have several questions. I would just like to remind everyone that if you have additional questions, you can go to the question and answer box on the lower right-hand corner of your screen and ask the questions. So I will start reading off the questions, and so far the majority of these questions it seems is going to you. Do you have examples or a resource that we can go to share to provide insight on the graphical representations that you talked about?
Actually, yeah. So I can send a link out after the meeting. I have a book chapter on graphical representation, but I don't have that publicly available. But I can put together some information on my website.
Okay, great. So we will definitely can forward out your website to others. The next question is, how do we choose the right incentives to offer for a financial education or financial coaching program?
So that's a pretty broad question. I think you'd want to try to understand better your population and who you're working with. And actually, I have many colleagues who study this question in particular: what's the right incentive to use? Whether the incentive works just in the short term or whether there are habit formation effects in the long term. We typically use randomized field experiments to try to answer these questions. So we look at some possible incentives that we think may work, and then we randomize participants to receive incentives to study the value of each one. If you did not have the ability to run a field experiment, you might want to think about doing some surveys to learn about what incentives are sufficient for people to come. It's often not going to be about monetary incentives. I think what happens with monetary incentives is the entire transaction is viewed as a market transaction rather than an intrinsically motivated transaction. So if I'm being paid to volunteer, that's very different from volunteering. But if I'm receiving a PIN for volunteering, I may still feel that I'm volunteering. So non-monetary incentives are something that can be explored more.
Okay, great. The next question that we have here is, we have an IDA program, an Individual Development Account program, and every person in the program has to use free tax preparation services. Should we offer an additional incentive on top of this? I think just, based, I guess they're asking just in the sense of based on how many incentives possibly should we be giving to an individual, because potentially the free tax preparation services would be an incentive and hopefully a behavior that they would keep afterwards, but should there be more than one incentive?
Well, I think that would depend on the proportion of people that are using the service. So if you notice that not many people are using the service, there may be a few barriers. So you might want to think about if there's a barrier to calling to set up the appointment. Maybe you want to make it easier for them to get into the network and then have reminders of someone calling them again and again to remind them to come in. That can often be an effective way to get people to show up, as if they have more accountability. I think probably if you're not finding that the free tax preparation is a sufficient incentive, it's because they don't receive the benefits right away. So do they receive their tax return right away after they do the tax preparation?
Right, so they would not.
Right. So it's possible that just that length of time is causing them not to choose to follow through. I think with some low-income populations especially, they have so many other stressors on a day-to-day basis that for us we might think, oh, of course free tax preparation is a great benefit. I'll fit it into my schedule. For low-income populations, that might not even be on their radar until it's too late to receive that. So in that sense, I think thinking about using commitment devices and reminder systems might work better than an incentive, and even an incentive as simple as a gift card that they can use right away can be helpful.
Okay, great. So lots of questions coming in here, and I know we only have 5 minutes left, but we might go over a few minutes over if people are willing to stay on just for a few more minutes, because we have quite a few questions coming in, which is great. So, and I'm reading as they're coming in. So can someone talk more about how people are willing to pay for a commitment device? And Nakia, that question came from you. Do you have anything else you can add to that question?
No, that was all that I got.
Okay. Anya, are you able to answer that?
So in general, the reason I said people are willing to pay for a commitment device is because of these time preferences that people have, which is that we put off doing things that we don't like to do to the future, but we believe that in the future we will do the things that we want to do. And so having a commitment device where I say I'm going to save, but I'm going to save more tomorrow rather than today, can be an effective way to get people involved in saving without requiring them to save right away. And similarly, it can get people to start attending the gym without requiring them to go right away, because coming in and doing a gym membership is less intimidating than starting to go to the gym every single day. So what we find is that people want commitment devices, and they're willing to pay for them in the sense that they may be willing to take a lower interest rate on a financial vehicle that in the long term they may have less liquidity on than a higher interest rate on one where they have more liquidity. So if they recognize that they have a problem with bounded willpower, they may be more likely to want to pay for that commitment device to help themselves. On the other hand, we might not want people to pay for the commitment device, but we may want to use commitment devices as a way to get people to save.
Great. So the next question is there one key strategy that your research highlights as the most important in changing the behavior of individuals seeking to improve their financial capability?
I think that's an open question. It's what we've really been trying to do is learn about whether it's incentives or social information or reminders or all three of these things that are going to have the biggest impact at improving financial behavior.
All right. How do you know when a problem is actually behavioral in nature? In many cases, problems that seem behavioral are actually more structural. Do you have any guidance or baseline questions a program should ask itself to understand this?
Well, I think the structure of the program may be what's causing the behavior that you observe. So if you have a program in which it's very time costly for people to come in and register for it, requires a lot of paperwork, there's not a lot of face-to-face interaction or social pressure to continue with the program, then you would have behaviors that correspond to that. So people that are less likely to join because of this barrier of taking a lot of paperwork, people who choose not to show up if they're not reminded to come by someone else that's a real person, and these sorts of things. So you really want to think about kind of what are the behavioral barriers and look at the bounded willpower and bounded rationality, especially to see if the way the program is set up is causing people to act in line with those behavioral biases.
All right. What are some ways of helping individuals overcome the influence family and friends who don't have particularly good financial practices? So what are some of the ways in helping individuals overcome the influence of others?
I think that's really hard. So we know very little about especially how behavior is formed across the life cycle. So when kids are younger and they learn from their parents to behave in a certain way, how we can overcome those effects later in life. Those are all open questions at this point. and we really want to think about whether we can have better role models for people or whether we can incentivize them in some way to start forming new habits.
All right, great. And do you have ideas for how to motivate financially stressed individuals to enroll in a financial literacy class? I guess that kind of goes back to looking at the best incentives.
So we actually run a program in the south side of Chicago which is for financially stressed families, but it's a parenting class. And we offer incentives such as free childcare for the children. And we also focus a lot on peer-to-peer interaction, so having people in groups within the within the parenting class, but essentially having people in a group where once they arrive, there's 3 other people that are in their group that they check in with, and me knowing that you're going to be there and I'm choosing not to come may be more likely for me to attend. So social pressure types of ways could be useful, and accountability among the 3 people in that group. So these types of things have worked very well for Weight Watchers, for example, where you know that you have to be accountable to others in your peer group, that I think could also be effective for financial literacy classes.
All right, great. Thank you. And I know we've come up to 2 minutes after 4, and there are several more questions that have come in, and we have run out of time. So what I'd like to do with these additional questions is I will send them over to the Center for Financial Security and to Anya and to Nicole and Bank of America, and we will answer these questions. If that's okay with you, Anya, we can send them to you and answer them, and then we will attach this as send the responses out to everybody who registered for the webinar who participated today. So Anya, if you're in agreement with that, we could go that direction.
Yep, that sounds great.
Okay, excellent. Well, thank you. I would like to thank everybody for participating on today's webinar and for asking these great questions. I think that this has been, out of all the webinars I've done, this has been one that we've had lots of questions and great feedback, so we really appreciate that. And please be sure to complete your evaluation and let us know other topics you would like to explore, or if you'd like to explore this topic even more, then we can host another webinar possibly on this topic as well and go a little bit deeper. For additional resources, please visit our website at www.realeconomicimpact.org, and also feel free to sign up for our listserv, and there's information on your screen on how to sign up for our listserv as well. A special thank you to Bank of America for their support of this webinar series and really looking at how do we build the financial capabilities of persons with disabilities and understanding different terms and different topics that we've heard about, and really allowing us to ponder these thoughts and see how these apply to persons with disabilities, and really looking at how to build a better economic future. So special thanks to Win Lum for his participation today as well. After the webinar, if you have any additional questions, please feel free to contact me. My information is there, 727-278-1352 is my phone number, and my email address is on the website as well at mroush@ndi-inc.org. I would like to thank Nicole Truog as well as Dr. Anya Salmak, both with the University of Wisconsin, for being good friends to the National Disability Institute and for providing information with us today. Please note that our next webinar is June 12th at 3 p.m., and this would be the 3rd part of our series, and it's on integrated service delivery, and we will be hearing best practices of how organizations have brought various various pieces when it comes to financial literacy, asset development, and integrated them into their existing systems and programs. So please be sure to join us for that webinar as well. Once again, all questions, we will have them answered and send them out to everyone that has registered. I'd like to thank my colleagues, Elizabeth Jennings, as well as Nakia Matthews, for their support of today's webinar as well. Thank you again for attending, and we look forward to talking with you in June on our next webinar. Thank you.